Last September, I almost lost my own father to something I never saw coming. Not a medical error, not some rare genetic condition we missed. Complete ignorance. I've been a cardiologist for 17 years. I've performed over 2,400 cardiac procedures. I've published research. I've lectured at medical conferences. I've saved lives in the ER at 3 a.m. when every second counted. My father called me at 7:22 a.m. I remember the exact time because I was in the middle of my morning coffee scrolling through patient charts before heading to the hospital. "Son," he said, his voice strained in a way I'd never heard before. "I feel dizzy. My heart's racing. Something doesn't feel right. Now you need to understand something about my father. He's not the type to complain. He grew up in a generation where you tough things out, where you don't call your son the busy doctor unless something is genuinely wrong." But I dismissed it. I told him what any cardiologist would say to their parent who just woke up feeling off. "Probably nothing, Dad. Your heart's just adjusting to being awake. Sit down, drink some water, take some deep breaths. It'll pass." I was so confident in my diagnosis that I didn't even consider telling him to call an ambulance. 48 minutes later, my mother was screaming into the phone. My father had collapsed in the kitchen. His lips were turning blue. She couldn't find a pulse. The ambulance arrived in 6 minutes. The paramedics worked on him for 12 minutes before they got a stable rhythm back. 12 minutes. Do you know what goes through your mind when you're a cardiologist and someone tells you your father's heart stopped for 12 minutes? Every worst-case scenario you've ever studied suddenly has your father's face on it. Every statistic becomes personal. Every percentage becomes a prayer. I met them at the hospital. I watched the ER team work on him. I stood there in my white coat with all my credentials and all my experience, completely helpless. A spectator in the most important moment of my life. The ER doctor, Dr. Patricia Chen, someone I'd worked with for years, pulled me aside after they stabilized him. Her face was serious, the kind of serious doctors reserve for delivering difficult truths. She asked me one simple question that changed everything. "What was your father doing this morning before the symptoms started?" I had no idea. I called my mother. She was still shaking from the trauma, but she walked me through his morning routine with the precision of someone who'd watched the same pattern unfold for months. "Nothing unusual," she said, "just what he does every day. Same thing for the past 8 months since he retired." And that's when it hit me like a freight train. His normal routine wasn't the problem. The timing of his normal routine was a ticking time bomb that had finally detonated. Before I go any further, I need you to do something for me. Write down in the comments right now what's the very first thing you do after waking up. Not what you think you should say, what you actually do. I'm serious. Write it down because what you're about to learn could save your life, but only if you're honest with yourself about what you actually do every morning. My father survived. After 3 days in the ICU and 2 weeks of recovery, he came home. But he's not the same man. He lives with the knowledge that his heart stopped, that he was clinically speaking dead for 12 minutes, that his brain was without oxygen for 12 minutes, while paramedics shocked his chest, trying to restart the engine that had been running for 68 years without pause. And the worst part, the part that keeps me awake at night, it was completely preventable. Since that day, I've become obsessed. I've interviewed over 180 patients who survived sudden morning cardiac events. I've reviewed every study on circadian cardiology, chronobiology, and cardiovascular timing I could find. I've spent hours analyzing data that most cardiologists never even look at because we're trained to treat disease, not prevent it. And I discovered something the medical community is only just starting to understand. There are 5 specific morning behaviors that create a perfect cardiovascular storm in people over 60. Not dangerous behaviors in themselves, not things that would raise red flags in a typical medical examination. But when you do them in the first hour after waking up, when your body is already under maximum physiological stress, they can stop your heart. My father was making one of these 5 mistakes every single morning. And based on the research I've done since, based on the conversations I've had with hundreds of patients, there's a very real chance you're making at least one of them too. If you're over 60, or if someone you love is over 60, I'm begging you to subscribe to this channel right now. Click that subscribe button because I'm going to spend the rest of this video sharing information that could literally prevent someone you care about from becoming another morning cardiac statistic. I know you might think you'll remember to come back later, but here's the truth. You won't. The algorithm will bury this, and the person who needs this information, maybe your parent, maybe your spouse, will never see it. Your subscription right now is how we make sure this reaches the people who need it most. Let me explain what happens to your body the moment you open your eyes in the morning. Because once you understand this, everything else I'm about to tell you will make perfect sense. Your body doesn't turn on like a light switch. It detonates. First, your circadian rhythm triggers a massive release of cortisol, the stress hormone. Within 15 minutes of waking, your cortisol levels spike by 50 to 60%. This isn't a gentle wake-up call. This is your body slamming the accelerator, forcing your heart rate up and constricting your blood vessels with brutal force. Second, your autonomic nervous system shifts violently from parasympathetic mode, rest and digest, to sympathetic mode, fight or flight. Adrenaline floods your system like a tsunami. Your blood pressure shoots up by 10 to 20 points in a matter of minutes, sometimes more. Third, after 7 to 8 hours without drinking anything, you're severely dehydrated. Your blood has become thick and viscous like honey instead of water. Your heart has to work 3 times harder to pump this sludge through your body. Now imagine your heart, a heart that's already been beating for 60, 70, or 80 years, facing this morning storm. Arteries that are naturally less elastic with age. Blood vessels that don't respond as quickly. A cardiovascular system that's been working nonstop for decades. And then imagine adding behaviors on top of this biological storm that amplify the stress even further. That's what my father did. That's what millions of people do every single morning without realizing they're playing Russian roulette with their cardiovascular system. The first deadly mistake is something 87% of people do without even thinking about it. Jumping out of bed the second the alarm goes off. You hear the alarm, your eyes open, and immediately, like you're responding to a fire alarm, you swing your legs over the side of the bed and stand up. You're in motion before your brain is even fully conscious. It seems efficient. It seems disciplined. It seems like what productive people do. But for people over 60, this simple movement can trigger something called orthostatic hypotension, a sudden catastrophic drop in blood pressure that can cause falls, fainting, and in extreme cases, fatal cardiac arrhythmias. Here's what happens in your body. When you've been lying down for 8 hours, your blood is distributed evenly throughout your body. Gravity isn't pulling it anywhere. It's in equilibrium. The second you stand up abruptly, gravity suddenly pulls up to 1 liter of blood down into the veins of your legs and abdomen. 1 full liter. That's a massive redistribution of your blood volume in seconds. Your heart suddenly has much less blood to pump to your brain, and your brain needs constant blood flow to function. It can't store oxygen like muscles can. Every single second without adequate blood flow starts killing brain cells. In young people, pressure sensors called baroreceptors detect this drop instantly and tell the heart to beat faster to compensate. The response is so fast you don't even notice the adjustment happening. But with age, these sensors become slow and less sensitive. They're like smoke detectors with dying batteries. There's a lag between the drop in pressure and the compensatory response. And during that lag, your brain doesn't get enough oxygen. You feel dizzy, your vision blurs, you see stars, your legs feel weak, and in the worst cases, you faint and collapse. Falls are one of the leading causes of death in older adults. Hip fractures, head injuries, internal bleeding, and many of these falls happen in the first few minutes after getting out of bed when people faint from orthostatic hypotension. But the danger goes far beyond the fall itself. When your body finally realizes what's happening, when those slow baroreceptors finally sound the alarm, it panics, it overcorrects. Your nervous system releases a massive surge of adrenaline to jack your blood pressure back up. Your heart goes from struggling to pump enough blood to suddenly being forced to pump against extremely high pressure. This creates something called reflex tachycardia. Your heart starts beating fast and violently like an engine being revved from idle to maximum RPM in seconds. And this sudden violent acceleration can trigger fatal arrhythmias in a heart that's already under stress from the morning hormonal storm. Ventricular fibrillation, sudden cardiac arrest, dead before you hit the floor. The solution is absurdly simple. When your alarm goes off, stay lying down for 30 to 60 seconds. Take 5 deep breaths. Let your body know there's no emergency. Then sit up slowly and sit on the edge of the bed, with your feet on the floor for another 60 seconds. Move your ankles in circles to activate the muscle pumps in your calves that help push blood back up to your heart. Only then do you stand up slowly. Those 2 extra minutes could be the difference between a normal morning and an ambulance at your door. Write in the comments, do you jump out of bed immediately or do you take time to wake up slowly? Be honest. There's no judgment here. I just want you to think about your pattern. The second deadly mistake, almost no one thinks about not drinking water immediately upon waking. Most people go straight for coffee. Others head to the bathroom. Others grab their phone and start scrolling. They completely ignore that their body has spent 8 hours losing fluids through breathing and perspiration. Every breath you take releases moisture. Every hour of sleep, your body loses water. By the time you wake up, you're in a state of significant dehydration. This creates what's called heoconcentration. Your blood volume decreases, but the number of red blood cells, white blood cells, and platelets stays the same. The result? Blood that becomes thick, sticky, and dangerously prone to clotting. Imagine trying to pump honey through narrow pipes instead of water. That's what your heart is dealing with every morning when you don't hydrate immediately. It has to generate much more pressure to push thick blood through your arteries and capillaries. This dramatically increases the workload on your heart at precisely the moment when it's already under maximum stress from cortisol and adrenaline. But thick blood isn't just hard to pump, it's dramatically more prone to forming the blood clots that cause heart attacks and strokes. When blood is thick, platelets become stickier. They clump together more easily. They're like magnets being pushed closer together. And if there's any damage or instability in the plaque inside your coronary arteries, these sticky platelets pile up at the site, forming a clot that can grow until it completely blocks the artery. This is literally how most heart attacks happen. A blood clot forms on top of an unstable plaque and cuts off blood flow to part of the heart muscle. And it's no coincidence that most heart attacks occur in the early morning hours, between 6 a.m. and noon, when blood is at its thickest and stickiest. The statistics are terrifying. The risk of heart attack is 40% higher in the morning than at any other time of day. The risk of stroke is 49% higher in the morning. Why? Because of this perfect storm. Thick blood from dehydration, elevated cortisol, spiking adrenaline, and increased blood pressure all happening simultaneously. The solution is so simple it almost feels too easy. Leave a glass of water on your nightstand before bed. Make drinking 300 to 400 milliliters of room temperature water your absolute first priority. When you wake up, before your phone, before the bathroom, before coffee, before anything else, this simple habit immediately begins to reverse the HEO concentration. Within minutes, you're diluting your blood, making it more fluid, reducing the viscosity, lowering the load on your heart, decreasing the risk of clots forming. In a matter of minutes, you're literally diluting the danger. The third mistake is something 80% of people think is absolutely necessary to function. Drinking strong coffee, especially espresso or very concentrated coffee, on a completely empty stomach right after waking up. This is a cardiovascular bomb disguised as a comforting morning ritual. I love coffee. I'm not going to tell you to never drink it, but the timing and the way you consume it can be the difference between a harmless pleasure and a cardiac trigger. Caffeine is a powerful stimulant. It triggers a massive release of adrenaline from your adrenal glands. It accelerates your heart rate significantly. It causes vasoconstriction, narrowing your blood vessels, and spiking your blood pressure suddenly and intensely. Now remember, your body is already dealing with elevated cortisol, thick blood from dehydration, and the abrupt transition from sleep to wakefulness. Your cardiovascular system is already running at maximum capacity. Adding a caffeine shock on top of this is like throwing gasoline on a fire that's already burning out of control. For young people with elastic arteries and healthy hearts, this might be tolerable. The body can handle the additional stress, but for a cardiovascular system that's worked for 6, 7, or 8 decades, that has naturally stiffer arteries and potentially undiagnosed coronary disease, this combination can trigger dangerous arrhythmias, severe hypertensive crises, or even sudden heart attacks. When you drink coffee on an empty stomach, the absorption is dramatically accelerated. There's no food to slow it down. Caffeine hits peak blood concentration in your bloodstream in just 15 to 20 minutes, instead of the 30 to 60 minutes it would take if you had food in your stomach. This creates what I call a caffeine shock. Your cardiovascular system is instantly bombarded with a stimulant at precisely the moment when it's most vulnerable. Blood pressure can spike by 20 to 40 points within minutes. Heart rate accelerates to potentially dangerous levels, and your body enters a state of cardiovascular hyperexcitability, where any additional stress, any sudden movement, any emotional trigger can push you over the edge into arrhythmia or cardiac event. I've reviewed case studies of patients who had heart attacks within 30 minutes of drinking strong coffee on an empty stomach. Their autopsies showed coronary disease that had been building for years. The coffee didn't cause the disease, but it was the trigger that caused an unstable plaque to rupture and form the clot that killed them. My father didn't drink coffee, so this wasn't his trigger, but I've seen this pattern in dozens of the patients I interviewed after their morning cardiac events. The solution, if you cannot imagine a morning without coffee, and I understand that completely, never drink it on an empty stomach. Always eat something first. Even if it's just a banana, a handful of nuts, or a piece of toast, something to slow the absorption, reduce the concentration. If you normally drink espresso, switch to regular coffee. If you drink 3 cups, reduce to 1. And most importantly, drink at least 300 to 500 milliliters of water before you even think about coffee. Hydrate first, always. I want you to write down honestly. How much coffee do you drink in the morning? And do you eat anything before your first cup? No shame, no judgment, just awareness. Because awareness is the first step to change. The The fourth mistake is something many people do thinking it's incredibly healthy. Intense exercise in the first few hours after waking up, running, weightlifting, high-intensity interval training, spinning classes, any activity that drastically raises your heart rate when your body hasn't fully adapted to being awake. Let me be clear, exercise is fundamental for cardiovascular health. It's one of the most important things you can do to prevent heart disease, but timing is absolutely critical, especially for people over 60. Remember, in the early morning hours, your cardiovascular system is already facing multiple simultaneous stresses. Elevated cortisol, spiking adrenaline, thick blood from dehydration, naturally higher blood pressure, and stiff blood vessels that haven't warmed up yet. Adding intense exercise at this moment is like asking an engine that's already redlining to shift into an even higher gear. Your heart, which is already working in overdrive just to maintain basic function during the morning transition, suddenly needs to pump vastly more blood to active muscles. Oxygen demand skyrockets to levels that may be impossible to supply adequately, especially if there's any underlying coronary disease. For young hearts, with wide open and coronary arteries and elastic blood vessels, this might be manageable. The cardiovascular system has enough reserve capacity to handle the additional demand. But for an aging cardiovascular system, especially one with silent coronary disease that hasn't been diagnosed yet, this combination can trigger myocardial ischemia, dangerous arrhythmias, or even sudden cardiac arrest. The situation becomes even more dangerous when people exercise while fasting and dehydrated. Many people wake up, throw on workout clothes, and head straight to the gym or out for a run without eating or drinking anything. Intense exercise while fasting forces the body to break down muscle tissue for energy. It releases additional stress hormones, particularly cortisol, adding even more fuel to the fire. It can cause dangerous drops in blood sugar that further burden the heart and brain, combined with thick dehydrated blood that can't transport oxygen adequately. You're creating perfect conditions for cardiovascular collapse. Many cases of sudden death in gyms or during morning runs happen for exactly this reason. Apparently, healthy people who thought they were doing something good for their bodies, who didn't know they were stacking multiple risk factors in a potentially lethal combination. The solution: if you want to exercise in the morning, wait at least 2 to 3 hours after waking. Give your body time to fully transition from sleep to wakefulness. Drink plenty of water. Eat something light to stabilize blood sugar and provide energy. Allow morning cortisol and adrenaline to normalize before adding the additional stress of physical exertion. Always start with a very gradual and prolonged warm-up. Never go from 0 to intense in minutes. And consider moving your most intense exercise sessions to mid-morning, afternoon, or early evening when your cardiovascular system is more stable and better equipped to handle the demand. And now we come to the fifth and final mistake, the one that almost killed my father. Before I reveal it, I need you to do something. If this information has been valuable so far, if you can see how these seemingly innocent morning habits are actually putting millions of people at risk every single day, I need you to hit that like button right now. Because here's the brutal truth that nobody wants to talk about. I can spend hours researching, writing, and creating this content. I can pour my heart into sharing what almost cost me my father. But if people don't engage with it, the algorithm buries it where no one will ever see it. And that means the people who need this information most, the people who are making these exact mistakes right now, the people whose lives could be saved by watching this video, will never get the chance. Your like isn't just a button. It's literally how we save lives. So please, if you've made it this far, if you believe this information matters, show me by liking this video right now. The fifth mistake is the most devastating of all. It's something wellness influencers and biohacking gurus promote as the holy grail of longevity. Something my father adopted because he genuinely wanted to be healthier. Something he read about in articles and watched videos about. Something he did religiously every single morning for 8 months before it almost killed him. Taking an ice-cold shower or any form of extreme cold exposure immediately after waking up. My father had been watching videos about the benefits of cold exposure. Increased energy, improved mood, strengthened immune system, better metabolism, reduced inflammation. It all seemed backed by science. It seemed like the smart, proactive thing to do. Every morning he would get out of bed and go straight to the shower. He'd turn the water to maximum cold. And he'd stand under that freezing water for 2 full minutes, breathing through the shock, convinced he was investing in his health and longevity. On the morning he collapsed, he did exactly that. He woke up, went to the bathroom, turned the shower to cold, and the moment that ice water hit his chest, his cardiovascular system went into total collapse. His heart stopped. Here's the terrifying science behind what happened. When your body is exposed to extreme cold, especially cold water, directly on your torso, it interprets this as a direct threat to survival. Your body immediately activates every emergency mechanism available to preserve core body temperature and protect vital organs. In seconds, something called massive peripheral vasoconstriction occurs. Thousands of small blood vessels in your skin and extremities slam shut simultaneously. Not gradually, not gently. They close like floodgates, slamming shut in a flood. Imagine your cardiovascular system as a network of pipes carrying water under pressure. Suddenly, thousands of the smaller pipes close completely. All that blood that was flowing through those vessels now has nowhere to go. The pressure in the remaining open vessels, the main circuit, instantly explodes. Studies show that cold water immersion can raise systolic blood pressure by 20 to 40 points in seconds. But for people with already elevated pressure or a compromised cardiovascular system, these numbers can be even more extreme. Some studies have documented spikes of 50 to 60 points. For a heart that's been beating for decades and arteries that are naturally less elastic with age, this sudden, massive increase in pressure is catastrophic. It's like trying to inflate an old, dried-out balloon too fast. The rubber has lost its elasticity. It can't stretch to accommodate the pressure. The risk of rupture is extremely high. Whether it's an unstable plaque in a coronary artery that ruptures and causes a sudden heart attack, or a weakened blood vessel in the brain that bursts and causes a hemorrhagic stroke, the outcome can be fatal within minutes. But cold shock doesn't just spike blood pressure to dangerous levels. It also forces the heart to work with brutal intensity. To overcome the massive cardiovascular resistance that was created instantly to pump blood through thousands of constricted vessels against skyrocketing pressure, the heart must beat harder and faster, much faster. Oxygen demand skyrockets to levels that may be impossible to meet, especially if there's silent coronary artery disease, which is extremely common in people over 60. Most people have some degree of coronary disease and don't even know it because it hasn't caused symptoms yet. When the heart is forced into this extreme level of oxygen demand and the coronary arteries can't deliver enough oxygen-rich blood to meet that demand, the result is severe myocardial ischemia. The heart muscle is literally suffocating. This is where the most dangerous arrhythmias develop, especially ventricular fibrillation. The heart's electrical system becomes completely destabilized by the lack of oxygen. Instead of beating in a coordinated rhythm, it simply quivers chaotically. No blood is pumped to the brain. No blood is pumped to the rest of the body. This is cardiac arrest, and if not reversed within minutes with a defibrillator, it's fatal. My father developed exactly this deadly arrhythmia. The cold shock was the final straw that his cardiovascular system, already overburdened by the morning danger zone, simply could not handle. The paramedics had to shock him 4 times before they got a stable rhythm back. 4 times they had to stop his heart with electricity and hope it would restart in a normal pattern. What makes this even more sinister is that morning cold exposure is being massively promoted on social media by influencers who have absolutely no understanding of the specific cardiovascular risks for older adults. You see viral videos of 2 5-year-old athletes taking ice baths at sunrise. Millions of views. Thousands of comments saying, "I'm going to try this tomorrow." People in their 60s and 70s watching these videos and thinking, if they can do it, I should be able to do it too. But what works for a young athlete with elastic arteries, low baseline blood pressure, and no cardiovascular disease can be literally lethal for someone over 60 with decades of cardiovascular wear, borderline blood pressure, or asymptomatic coronary disease they don't even know they have. The wellness industry has created a dangerous culture where more extreme always equals better, where pushing your body to uncomfortable limits is always beneficial, where if something is difficult and shocking to your system, it must be making you stronger. But aging bodies don't work that way. They require different approaches. Approaches that work with your physiology, not against it. Approaches that respect the reality of decades of accumulated cardiovascular stress. My father had even felt warning signs in the weeks before his collapse. Strange palpitations during cold showers, moments of dizziness, brief chest discomfort. But he interpreted these as signs his body was adapting, getting stronger, building resilience, not as urgent warnings that he was pushing his system beyond safe limits. He thought he was being tough. He thought he was being disciplined. He thought the discomfort was the price of improvement. He was wrong. The solution, if you're over 60, avoid extreme cold exposure completely, especially in the first few hours after waking when your cardiovascular system is already under maximum stress. If you genuinely want the potential benefits of cold exposure, and there are legitimate benefits for some people, implement them gradually and safely over many months. Start with lukewarm water, not cold. Reduce temperature by just 1 degree per week. Always direct cold water to your extremities first, your feet and hands. Never starting with cold jets directly on your chest or head. And most importantly, if you feel any cardiovascular symptoms at all, palpitations, dizziness, chest pain, shortness of breath, or unusual fatigue, stop immediately and seek medical evaluation. These are not signs of adaptation. They're warning sirens that you're in danger. Here's what I want you to write in the comments. How many of these 5 mistakes are you making regularly? Just give me a number, 1 through 5. Be completely honest, because I guarantee most people watching this are making at least 3 of them, without even realizing the cumulative risk they're creating. Now, before I share the morning protection protocol that my father now follows religiously, the protocol that has kept him safe and healthy for 3 years since his near-death experience, I need to be completely transparent with you about something. This information is based on scientific evidence and clinical experience from treating thousands of patients, but it does not replace personalized medical evaluation by a doctor who knows your specific health history. If you have pre-existing medical conditions, diagnosed heart problems, high or low blood pressure, diabetes, a history of arrhythmias, or any chronic condition, you must consult your doctor before making significant changes to your morning routine. If you take medications regularly, especially cardiovascular medications like beta blockers, ACE inhibitors, diuretics, or blood thinners, these habit changes can interact with your drugs in ways that require dosage adjustments. My responsibility is to provide evidence-based educational information that can start important conversations and potentially save lives. Your responsibility is to use this as a starting point for discussion with your healthcare provider, not as a definitive prescription that bypasses professional medical guidance. Not everyone who makes these mistakes will develop cardiovascular problems. Not everyone who corrects them will see immediate dramatic benefits. Health is complex and individual. But for people in higher risk categories, especially those over 60 with cardiovascular risk factors like high blood pressure, diabetes, high cholesterol, smoking history, or family history of heart disease, these small modifications can make a life or death difference. The key is to approach changes with common sense, moderation, and medical guidance when necessary. Now let me share the 5-minute morning protection protocol that transformed how my father starts each day. The protocol that went from being a suggestion I desperately wished he would follow to a non-negotiable routine he credits with giving him his life back. Step 1. The awakening minute. When the alarm goes off, stay lying down. Resist every urge to jump out of bed and start your day immediately. I know the instinct is strong. I know you feel like you're wasting time. You're not. You're saving your life. Breathe deeply and slowly through your nose for 4 seconds. Hold that breath gently for 4 seconds. Then exhale slowly through your mouth for 6 seconds, making the exhale longer than the inhale. Repeat this breathing pattern 5 times. This controlled breathing sends a powerful signal to your nervous system that there's no emergency. It helps modulate the cortisol and adrenaline release that's already happening. You're giving your cardiovascular system a gentle, gradual wake-up instead of an abrupt shock that forces it into crisis mode. Step 2. The hydration minute. Before you go to sleep tonight, leave a large glass of room temperature water on your nightstand. At least 300 to 400 milliliters, not cold water from the fridge. Room temperature. In this second minute after your breathing minute, sit up slowly on the edge of the bed with your feet flat on the floor. Don't stand yet. Just sit. Now drink all of that water. All of it. Every drop. This immediately begins reversing the nighttime hemo concentration. Your blood becomes more fluid within minutes. You're removing a massive load from your heart's workload. You're literally diluting the danger, thinning the blood that had become dangerously sticky during the night. Step 3. The adjustment minute. Stay sitting on the edge of the bed for another full minute. Don't stand up yet. I know you're anxious to start your day. 1 more minute won't make you late, but standing up too soon could make you dead. While sitting, make gentle circular movements with your ankles. 10 circles in one direction, then 10 circles in the other direction. This activates the muscle pumps in your calves that help push blood back up toward your heart, fighting against gravity. This minute allows your baroreceptors, those pressure sensors I mentioned earlier, to adjust to your new position. It ensures your brain receives adequate blood flow when you finally stand. It prevents orthostatic hypotension and the potentially fatal consequences that can follow. Step 4. The activation minute. Still sitting on the edge of the bed, use this minute to gently wake up your muscles that have been inactive during sleep. Slowly turn your head side to side, gently stretching your neck. Lift your shoulders toward your ears. Hold for 2 seconds, then relax them down. Reach your arms above your head and stretch gently. Do slow side stretches, leaning gently to the left, then to the right. These gentle movements send oxygenated blood to muscles that were dormant during sleep. They prepare your body for activity in a gradual, safe way that respects your cardiovascular system's need for gentle transitions. Step 5. The transition minute. Finally, after 4 full minutes of preparation, stand up slowly. Not quickly, slowly. Pause for a few seconds while standing to ensure there's no dizziness, no lightheadedness, no visual disturbances. If you feel anything unusual, sit back down and wait another minute. Then walk slowly toward the bathroom or kitchen. Don't run, don't rush, don't check your phone while walking. Give your full attention to this transition. You've now made a gradual, respectful, safe transition from rest to activity. You've worked with your cardiovascular system instead of against it. These 5 minutes might seem insignificant compared to the 24 hours in a day. I know the modern world tells you every minute must be productive. I know you think you can't afford 5 extra minutes in the morning, but these 5 minutes are literally the difference between waking up safely and becoming a morning cardiovascular emergency statistic, between living a long, healthy life and becoming another case study of sudden cardiac death. My father now follows this protocol religiously. 3 years after his near-fatal collapse, he has more energy throughout the day. He sleeps better at night. He has peace of mind knowing he's no longer gambling with his life every single morning. And here's what I need from you right now. If you've made it this far, if this information resonated with you at all, if you can see how it might save your life or the life of someone you love, I need 3 specific things from you. First, subscribe to this channel. Not for me, not for the algorithm, for the person you care about who desperately needs to see this. Because YouTube only shows content to people whose friends and family engage with it. Your subscription literally determines whether this reaches your mother, your father, your spouse, your friend who's at risk. Click subscribe right now. Second, turn on notifications by clicking the bell icon. I regularly share evidence-based medical information that prevents health emergencies before they happen. Information that could make the difference between prevention and catastrophe. But it only matters if you actually see it when I post it. Third, and this is the most important action you can take today, share this video with 3 people you love, especially anyone over 60. Anyone with high blood pressure, diabetes, or cardiovascular risk factors. It could be a parent who takes cold showers every morning, a friend who jumps straight into intense workouts at dawn. Anyone who deserves to know their supposedly healthy habits might be putting their life at risk. My father could have died if my mother hadn't been home that morning. He would have died alone on the kitchen floor. If she hadn't acted quickly and called 911 immediately, he would have died. If the paramedics hadn't arrived within 6 minutes, he would have died. If they hadn't shocked his heart 4 times until it restarted, he would have died. But he's alive. And every day I have with him now is a gift I almost lost because of ignorance. My ignorance, his ignorance, our collective ignorance about the dangers of the morning transition. You can prevent someone you love from going through that experience simply by sharing knowledge. Knowledge that costs you nothing, but could be worth everything to someone who needs it. Write in the comments which step of the morning protection protocol you'll implement first tomorrow morning. Research shows that stating your intention publicly makes you 3 times more likely to actually follow through. So commit right now. Tell me which step you're starting with tomorrow. The transition from sleep to wakefulness is one of the most delicate, dangerous moments of the day for your cardiovascular system. Don't underestimate it just because it happens every single day. Don't wait for chest pain or a collapse or an ambulance before you take this seriously. Prevention is the greatest act of love you can perform for yourself and for the people who depend on you. For the people who would be devastated if they lost you to something completely preventable. Thank you for watching until the very end. Thank you for committing to your cardiovascular safety. Thank you for caring enough about yourself and the people you love to spend this time learning how to protect them. Implement the 5-minute protocol starting tomorrow morning. Respect your heart. Respect the decades of work it's done for you without ever taking a break. And I'll see you in the next video with more information that can transform your health and prolong your life in ways you can't even imagine right now. Because I almost lost my father to ignorance.